You probably know that having gum disease is not ideal, but when a large majority of the population does, you might wonder, so what's the big deal? Gum disease is a bacterial infection that wreaks havoc on gums, teeth, and overall health. The first stage of gum disease is called gingivitis, and more advanced gum disease is called periodontal disease or periodontitis. Gum disease is the leading cause of tooth loss in adults and can have serious consequences for your overall health. One of the most common signs of gum disease is bleeding gums. If your gums bleed at all when you brush or floss, we're sorry to tell you, you have gum disease. Other signs you may be infected include red, swollen, or tender gums, gum recession, or persistent bad breath. You may have guessed that gum disease is largely caused by poor oral hygiene. The bacteria in your mouth feed on leftover sugars, producing plaque and acid, and an acidic environment is a breeding ground for pathogens or harmful bacteria that cause infection. Poor oral hygiene is not the only player at work here, however. There are many other factors that increase your risk for gum disease, including an inflammatory diet, family history, tobacco and alcohol use, dry mouth, misaligned teeth, diabetes, stress, and hormonal changes, including pregnancy. Left untreated, gum disease causes gum recession, which means the gums deteriorate and pull away from the teeth. Gum recession leaves the sensitive tooth roots exposed and more prone to infection, and creates deep pockets between the gums and teeth that allow the infection to progress. Eventually, the gums retreat so far, they are unable to support the teeth, causing tooth loss. Unfortunately, the damage does not stop there. When your gums are bleeding, the bacterial infection has a direct pathway to enter the bloodstream and flow throughout your body, directly into your main lifelines, your heart and brain. The bacteria associated with gum disease have been linked to at least 52 other serious systemic health problems, including heart disease, stroke, diabetes, and Alzheimer's. If any of this sounds familiar, or if you've already been diagnosed with gum disease, you should seek treatment as soon as possible to minimize damage and prevent serious health consequences. Your treatment will depend on the level of infection and tissue damage, including improvements to your oral hygiene routine and more regular deep cleanings with your dentist. In more severe cases, gum surgery or a gum graft may be required to supplement the gum tissue and save your teeth. Keep in mind, gum disease is transferable through saliva, and the most common vehicles include mothers, lovers, and dogs. So if one person in your family is infected, it's likely the rest are as well, and think twice before allowing your dog to smooch you on the mouth. If you have any questions about gum disease or would like to schedule an appointment, we would be happy to help.